Gestational diabetes is the type of diabetes that occurs in a woman during pregnancy. Even women without risk factors are at risk for gestational diabetes, so all women who are pregnant should be screened.
Everybody should be screened at the 24-week mark. It's all about the hormones, and that's when we have decided was a good time to start checking.
If you're diagnosed with gestational diabetes, the first thing you should do is become educated. Learn about diabetes and learn how to take care of the condition. Working with a diabetes educator during pregnancy is a good idea. They can help you with your blood sugar targets, with your nutrition, with your physical activity, and with all the things that may come up during pregnancy.
We spend time talking about stress management, namely making sure that these moms are getting enough sleep at night. In addition to that, the gestational diabetes patient has to learn how to use a blood sugar monitor to check blood sugars 4 times a day. Take insulin injections if she needs to. Go to extra doctor's appointments.
We monitor women with gestational diabetes pretty closely. They'll see their doctors more frequently.
If blood sugars don't stay where they need to be, both the mother and baby are at risk for certain complications.
The mother could go into labor too soon, or the baby could be too large, which could result in the baby getting wedged in the birth canal and may require a C-section. These children are at increased risk later in life for becoming overweight or obese, or even developing diabetes themselves.
Some of the risks to the mom would be preeclampsia, risk for infections like urinary tract infections, yeast infections, bladder infections, fluid retention, and then also risk for having a C-section.
You get your blood sugars in the normal range by following a healthy lifestyle, exercising regularly, and for some women, medications or even insulin may be necessary. A healthy, balanced diet has healthy carbohydrates, protein, and small amounts of healthy fat.
We spend quite a bit of the time talking about food. How much to eat, when to eat, and really the idea is to make it as individualized as possible.
For most women with gestational diabetes, it's important to stay active. You want to do mild, low-impact exercise that can help with controlling the blood sugar.
We know that just walking, has a huge impact on blood sugars.
Treating gestational diabetes is a team approach. You need to work with a diabetes educator, your obstetrician, perhaps an endocrinologist or a perinatologist to make sure that your blood sugars are in the normal range as much as possible.
One of the biggest things that these women can do is to make sure that they have a good support system. A family member, a friend that can help out with this. And the number one thing that we tell these women to do is just relax. As hard as it can be during all of this is just to relax, because we know that that added stress is going to do nothing but send blood sugars higher than they need to be.